everybody. Thank you for joining another Hub One-on-One. My name is Imani Moore. I'm the engagement coordinator here at Austin Coming Together in the Community Hub. And I first want to introduce you to the Austin Community Hub. The Hub was designed to be a dedicated space where we can engage with the members of our community. So we're here to serve as a connection between Austin residents and all the services that are offered by ACT's network of partner organizations. If you didn't know, or if you haven't noticed, we will now be hosting two Hub 101s per month. One dedicated to our workforce partners that provide career services such as job training and placement, and one other highlighting our other partner organizations specializing in anything from housing to childcare, youth programming, legal assistance, and much more. Each Hub 101 gives you all an opportunity to get to know our different partners and get live answers to your questions. And for the first time, you have the option to join the Zoom call directly from the Zoom webinar feature, or we'll be still streaming Facebook Live. For those of you who are watching on Facebook right now, if you prefer to watch that way. Okay, with no further ado, today we've invited Cook County and County Care to talk about the great work that they do. We'll be hearing from Heather Holberg, Director of Enrollment and Outreach for County Health Plan, and Marcelino Garcia, Director of Community Affairs for Cook County Health. We'll then have some time for your questions, of course, after the presentation. You can either use the Q&A feature on Zoom or continue to type your questions into the chat if you're watching from Facebook Live. Thanks for being here, Marcelino and Heather, and the floor is all yours. I'll pass it over to you guys.
Thank you so much, Imani. Hello, everyone. I'm Marcelino Garcia, Director of Community Affairs at Cook County Health. Just a quick overview of what we're going to do today. We're doing some introductions. We're going to talk about Cook County Health in the community with an overview of what the healthcare system does, but also focus on outreach activities and event participation. Then Heather's going to provide an overview of county care, what is Medicaid, redetermination, the County Care Rewards Program, and as Imani said, we will have a question and answer session at the end. I do want to start by thanking you for being here today, but also many thanks to Austin Coming Together and particularly the Hub, because you guys are an integral part of the community. So we value your partnership and we value the ability to transmit a message to everyone who may be listening in person, through Facebook, or afterwards. So next slide, please. Cook County Health. Most of you may know Cook County Health has been around for more than 180 years. It started at the old Cook County Hospital, which is now part of the Stroger campus. But our forefathers and mothers always wanted to make sure that residents from the county had access to care from the earliest times. So this is the mission of Cook County Health, and this is what we stand for more than 180 years. Next slide. One of the big things about Cook County Health, and I like to start all my meetings with our mission, and our mission is to establish universal access to the world's best care and health services for all Cook County residents, regardless of the ability to pay, so all may lead their healthiest life. And, it's very important to us, anyone who's a member of the Cook County Health family, to ensure that the residents and people who live in Cook County have access to healthcare. And you will keep hearing this message over and over again throughout this presentation from either Heather, from County Care perspective, or me, from a Cook County Health perspective. We stand by our vision, which is to ensure that health is a human right, and our values, which every one of our employees stands for, is I care, and that stands for innovation, compassion, accountability, respect, and excellence and education. Next slide. This slide really provides you kind of the image of what Cook County Health is. We provide health services in the city of Chicago and the suburbs. of Cook County. We're the second most populous county in the US, and it has about 5.1 million residents. Cook County Health is headed by President Tony Preckwinkle of the Cook County Board of Commissioners, and all of our commissioners are part of the Cook County Board. If I'm right, Commissioner Tara Stamps for this first district covers most of the Austin area. She's a great commissioner, new to the role from a few years back, but she's an advocate for your healthcare. In addition to that, Cook County Health is governed by a board of directors, which is appointed by the Cook County Board of Commissioners. So that's Cook County Health in general. Within Cook County Health, we have the healthcare system, which is comprised by Stroger Hospital, Provident, the Core Center for HIV/AIDS and Infectious Diseases, CIRMEC Health Services, which provides healthcare at the Cook County Jail and the Juvenile Detention Center, and our ambulatory network. Part of Cook County Health, you also have the Cook County Department of Public Health, which regulates healthcare all throughout suburban Cook County, with the exception of Evanston, Skokie, Stickney, and Oak Park, and County Care Health Plan, which you will hear a little bit more from Heather about. Next slide. These are our numbers in 2023. So we saw more than 900,000 outpatient registrations. We filled over 8.9 million prescriptions. We had more than 200,000 unique patients. We had more than 45,000 behavioral health visits. And behavioral health is something that's particularly important to the health system and county care. Our behavioral health and mental health department just did some grants for behavioral health initiatives. More than 40 or 50 some organizations are doing projects all throughout the county, totaling $44 million. So we hope that those projects are able to improve people's health and access and provide a betterment to the community in general. Next slide. These are our patient demographics. While a large percentage of our patient population is Medicaid, we also have a huge percentage that's Medicare. We do take all PPOs and commercial plans. Our patients are mostly African American and Hispanic, but we have people coming from all parts of and all segments of society coming to the healthcare system. We have the ability to see patients and talk to them in the languages that they speak. Is it Spanish, Polish, Tagalog, or whatever other language? We have access to translation services to ensure that the care is appropriate and done in a correct manner in which the patient can understand what's going on. Next slide. This slide kind of shows what the health system is. We provide care, but we also are a provider of coverage. We educate people. We're one of the largest residency programs for medical students in the country. We work with innovation. One of the things that happened at Cook County Health early on had to do with blood, and the first blood bank in the United States was here. And we are also a steward of public health. So we make sure that, in the pandemic that just occurred, we were at the forefront with education, but also vaccination. Next slide. We completed a strategic plan a few years back. We will be coming back in the future as next year we will start our next strategic plan. And these are our pillars for anything having to do with strategy. And it's something that permeates all our units, from patient service, safety to workforce development. We want to make sure they're fiscally resilient, and that we keep having growth and innovate as we go along. Next slide. One of the things that people don't really know about, but in 2018 and kind of slowly growing into the future, Cook County Health comprised of Stroger and Provident, was the largest provider of what's known as charity care in the county. So our two hospitals provided more than half of all uncompensated care. And that's important because if you don't have access to healthcare, you will hear in this presentation of how you can see a doctor, how you can find coverage without having to worry about how you're going to pay those bills, which at times are significant and kind of shy you away from seeing a doctor when you should really go to see a doctor to take care of health issues. Next slide. So as I mentioned, Cook County Health is one system with many parts. Stroger Hospital and the main campus has, uh, that's where we're mostly located, and that's the hospital that people know about. Um, the former Cook County Hospital, it's now the Harrison Square building where County Care is located and our PTOT department. Provident Hospital is one of our main functions. And you may or may not know it's the first African American and oldest African American hospital in the United States. We're very proud of that history that we have at being part of the community and also giving back. We have 12 ambulatory health sites throughout the county from Arlington Heights all the way down to Fort Heights. In the Austin area, we have the Austin Health Center. Close by is Belmont Cragen, and we also have the North Riverside facility. The Ruth Rothstein Core Center was started in the 80s at the height of the AIDS pandemic, and it's our infectious diseases facility where we did a lot of innovation to treat that and take care of patients who are affected by that disease. As I mentioned, the Cook County Department of Public Health is also part of us. We do provide health services at our correctional institutions in Cook County and the County Care Health Plan. Next slide. This is our map of facilities, uh, which you can see from our two hospitals, our ambulatory sites throughout the county. Next slide. And I really wanted to plug in the Austin Health Center. The Austin Health Center is located at the intersection of Chicago and Cicero Avenues. And it's a great facility where we have family medicine, we have OB/GYN care, we have social work professionals, and it's your primary medical home. One of the things that I hope that you will want to do after you finish this presentation or hearing Heather and I talk is that if you don't have healthcare, please call our telephone numbers to see if you can get a medical appointment. You can also find out of ways that you can have um, insurance coverage after this. But this is our part of our brochure on the Austin Health Center. Next slide. We do have WIC services at Austin. In addition, we have a patient portal, and we do try to. We're modern. At times you hear if you come to any Cook County facility, you're going to wait. And right now, ever since I've been here for more than 10 years, we have our patient support center that schedules appointment and appointments are on time. So you really don't have to wait as long as uh, what used to be told in the latter years. Next slide. One of the things that we did at Austin recently is in order to make our facilities better and more accessible, we created murals inside our facilities. And in this picture, you can see the artist kind of at down below to the right, um, and our staff, children who were going to be at the facility, and we were painting. We were painting the mural that's now inside our facility that provides a vision and serenity while people wait to get their appointments. Next slide. Um, in terms of outreach, We have a robust team of outreach professionals that want to raise the level and share information about Cook County Health and our facilities and our plan also with anyone. So we are available to go to events throughout the community to talk to patients or normal citizens and residents about how to make appointments, how to access primary care at their medical homes. And we also do education. Right now, we have our stroke coordinator who's who would love to go to different groups to do presentations on stroke awareness. We also can talk about different topics. So, depending on what the ask is, we may have professionals who may be available to come to your meetings to talk about different health afflictions. Next slide. Very important slide for us. How do you become a patient? And it's simple. All you need to do is call 312-864-0200, and that will get you to the Patient Support Center. The Patient Support Center is staffed by bilingual professionals, and if you don't speak either Spanish or English, they will connect you to a translating company who will intermediate in the conversation. So our counselors will be able to find an appointment for you with a facility and a health professional close to you as they are able to set you up with a medical appointment. Some of the sample services are anywhere from family medicine to behavioral health to WIC and social work. Um, so please call 312-864-0200 if you have any questions, and our professionals are able to talk to you about how to get a medical appointment with you. Next slide. Um, you will hear more about County Care from Heather, but for County Care and CareLink, you can call our Financial Assistance Support Center, and that phone number is 312-864-8200, option number 1. So our professionals in that call center can provide information on how to apply for Medicaid, which you will hear from Heather. But if you don't qualify for Medicaid for whatever reason, you may qualify for CareLink, which is our financial assistance program, which gives you access to our 2 hospitals and our ambulatory sites. Next slide. And you can find more information by visiting our website, cookcountyhealth.org. We have information on CareLink requirements, also County Care. And County Care, the website is countycare.com. We do want to stress that we take all PPOs at Cook County Health. Next. So in terms of outreach, very important to us, we participate in over 400 community events throughout the year. You can see Alice on the top slide and our top photograph, and Kaylin on the bottom one at different sites. We have we have advisory councils at 8 of our different facilities, which I'll talk about in a little bit. We also have partnerships with the Greater Chicago Food Depository. We will be opening up a food pantry in the near future at our Belmont Cragen facility. And we participate with a lot of different community organizations, such as NAMI and many others. Next. Advisory councils, that's very important to me. We meet once a quarter. And in our meetings, we talk about different topics from healthcare system, healthcare, but also county care and things that are happening. We have 8 facilities from Arlington Heights to Blue Island to the Prieto Health Center to Robbins. But in the next year, we will be starting new advisory councils at both the Austin Health Center and the Belmont Cragen Health Center, which are 2 facilities which serve the general Austin community. You can find out more information by emailing me or by visiting our website and looking for community relations webpage. Submit your applications. So the councils are comprised by about 15 to 20 people, leaders from the community, leaders from partner organizations, average citizens, patients, and others, religious leaders, people who want to learn and who want to share information, but also people who are able to tell us what we're doing, what can we improve, and how we can collaborate better to improve people's health all across the city and the county. Next slide. These are some of the outreach programs that we do, from one-on-one assistance. When we meet people in the community, and if we get an issue, we figure out a way how to transmit that issue internally so that issues get resolved. As I mentioned, we are involved in advisory boards. One organization besides the Austin Coming Together, kind of which serves the west side and the near west suburbs, is the Community Alliance. We partner with them, we do presentations with them, and we participate in picnics, health fairs, and other things. The one thing that we don't do at this point is really do vaccinations at events. And I want to stress that because we prefer, if patients come to our health centers, to do overall health screenings and make sure that you're getting all the answers to questions, getting all the vaccinations that you need in a healthcare setting rather than in a community setting. Um, we do have an HIV program that does testing in the community. So if you would like for them to participate, just send me a note, and I know that they will be able to do that sort of testing in the community. Next slide. As I mentioned, these are some of the things that we do, from participating community meetings to our advisory councils. Next slide. And some of the resources that we did before the pandemic and after, from education on smoking cessation, endocrinology, trauma burns, and stroke. Next slide. We're proud of our collaboration with Defender Charities at the Bud Billiken Parade, which goes through by Providence Hospital. Um, so we've done a lot of we manage the first aid stations at the parade, and we also participate in it. We also participate in other parades. So if you let us know, we will be able to participate. Just recently, we did the parade hosted by PLCCA in Maywood on the west side. Next slide. And just more pictures from our teams doing volunteer work and ensuring that everyone had access to good health care and a safe environment at Bud Billiken. Next slide. You can always come to our website. We have community events that we're doing, from resource fairs to health fairs. We participated in we're participating in the Hanover Township Just for the Fun of It health fair, the Latina Expo at Malcolm X College last week. Respond Now Career Center Resource Fair. Next slide. Um, you can see here our presentation at the Austin Coming Together Hub 101 presentation, but we're very happy to come out and share information. If you're looking for employment, you can also come into our website. Cook County Health is always hiring. Most applications for employment are done through our Taleo system of Cook County. So you create a profile and you apply for different jobs. Not all jobs are medical related. You can do transportation, you can do food services, and other things. And our final slide, second to final slide, Heather will also touch on this, but we're doing redetermination events throughout Cook County. Really, events are important because it's how you keep your Medicaid coverage and you learn a little bit more about it. Um, I We had a reading event at our Austin facility on September 9th. We rotate them once a month all throughout our health centers and other partners. So you will be there. And final slide. Um, just visit our website, learn more about community relations and what we do, how we can help you. But most importantly, send me an email to Marcelino Garcia or Alice or Kaylin or all three of us. We will be more than happy to collaborate with you, help you share information to the community, and be a good partner in general. Thank you so much. And Heather, floor is yours.
Hi, good afternoon. My name is Heather Holberg. I'm the Director of Enrollment and Outreach for County Care. So I wanted to start just by County Care is a Medicaid health plan. So I wanted to give everyone just an idea of an overview of Medicaid and what it is and who qualifies. So Medicaid is a federal and state program. It provides free or low-cost health insurance to some people with limited income and resources. And when somebody's applying for Medicaid, they're going to be reviewing the applications for non-financial and financial eligibility. We go to the next slide. So what are those? So for the non-financial, the requirements are to be a resident. To apply for Illinois Medicaid, you must live in Illinois. This does not mean you need to have a permanent address, but you have to intend to stay living here. There's no length of stay requirement on that. And then for citizenship, for ongoing Medicaid coverage, you do need to be a legal permanent resident for 5 years or longer, with the exception of pregnant women and children 18 and younger. However, if somebody does not meet that, there are other programs for if emergency care is needed. And then also through Cook County Health, we would help to see what someone else may qualify as well if Medicaid does not fit for them. You can go to the next slide. For the financial, there are income thresholds, which I have a slide coming up on, but the state wants to look at the last 30 days of income. And there are some income that would not be included in that calculation, and that would be Social Security income, so the SSI, child support, SNAP, or any other public benefits. And then if somebody is close to the threshold, there are deductions that could be made if they are paying any student loan interest, alimony, self-employment expenses, and any retirement contributions. So that is just like a brief overview. Of course, there are situations where assets will be looked at and things like that, but this chart gives you just an idea if you want to see if you're in the ballpark to be able to apply. So you look at the family size and then what category you would fall under. So just briefly, the All Kids Assist would be for our children, the 18 and younger. The AC adults are, I'm sorry, that age is wrong there. The 42 to 64, I'll correct that. That's actually 19 to 64. And then our family health care, those are our family plans, so moms, dads, parents, and their children living in the home. And then that AABD is our age to the aid, blind and disabled population. And then moms and babies are the moms and the pregnant women. And the children under 12 months. Then you can go to the next slide. So if somebody does not have health insurance and wants to apply for Medicaid or find out if they are eligible, there's several different ways someone can do this. As Marcelino mentioned, Cook County Health has an application assistance call center where they work in partnership with Cook County Health. There is a Stroger Family Community Resource Center. That is a true DHS office with state employees, not county employees. But however, all of the Cook County Health applications are going to route to this office. And this office also does not allow for walk-ins. So it streamlines all the applications to them. And we do find that somebody applying through Cook County Health, their application is going to process much more quickly than had they gone to a local office or used the state's online system, the abe.illinois.com, which is a second option underneath calling. And then, of course, they can go in person to any DHS office, or if they prefer, there's an online paper application that can be downloaded, filled out, and then either faxed, taken into a DHS office, or mailed in. And then, so once somebody applies for Medicaid, most people are going to be mandated to be in a Medicaid managed care, which is a county care would be an example of those. But for an overview of what that means, is really managed care is a healthcare plan or system that's seeking to control the medical costs. So we're contracting with a network of providers, requiring certain authorizations for visits to specialists. But the overall goal of this is really to improve the quality of care. So that way we have members seeing their primary care doctors and then really seeing what specialty care they may need and helping them get that. And this keeps, it allows for more preventative health care that is overall will reduce costs and improve health care or health outcomes. So in Illinois, there are 5 plans, and it's managed through, it's called Health Choice Illinois. The Department of Healthcare and Family Services administers this, and the 5 plans, which you can see on the right, are Aetna Better Health, Blue Cross Community Health Plans, Meridian Health, Molina Health, and Youth Care. Youth Care is formerly known as Illini Care, and it serves the DCFS Youth in Care and former Youth in Care. And then County Care is, we serve only the residents of Cook County, makes us a little unique from the other plans. And we're also the only public provider-led Medicaid health plan within the state. So now I wanted to give you a little bit of the County Care health plan highlights. County Care is actually, we cover all of Cook County. So we do have all of Cook County Health in our network, as well as pretty much a ton of providers throughout Cook County. So you can see here we have 6,600 primary care providers, 26,000 specialists, 70 hospitals, and over 150 urgent care facilities. We are also in the process of adding telehealth, so we will update that number shortly. We have no copays, and this is for any of our members seeking any service. They will never have a bill, as long as it's a covered service. We offer prescriptions by 90-day mail to your home, and we also contract with a large variety of pharmacies throughout Cook County and the state. So your Walgreens, CVS, Walmart, Target, all of those are within our network. So members can go pretty much anywhere to fill a prescription. I'm going to do a presentation in a little bit, give you more information on our rewards that our members can earn. We also do have transportation to not only medical appointments, but if somebody needs to go to the pharmacy, a WIC office, even one of our events, they can call us. We will either give them a ride or we can send them out CTA cards so they can use the train or bus. And then we do a lot of things around wellness. One of the things I'll highlight on this list is if we have a member maybe leaving the hospital that doesn't have good housing or stable housing, we're able to offer them a place to stay while they recover and are well enough to go back into the community. All right, so for our members, we do offer a very robust rewards program. And how it works is we actually do send them a Visa card that works like a debit card. And for certain services, which I will show you, they're going to earn money that will go on that card. Once we receive the claim, we put the first reward on there and mail it out to our member. Any subsequent rewards will go on that same claim. Because it's claim-based, sometimes it can take up to 180 days. We have to allow for the provider to bill us so that we can recognize that the member did earn a reward. And each member is going to get a card. So if it's a mom with multiple children, each child will get their own card. Although we're mailing it to the parent, we do indicate which child earned it so that they are aware of what each member is actually earning. And the funds are going to stay on that card. They'll have 6 months to spend the money. And then if they don't, unfortunately, it will expire. You can go to the next slide. So this, there's 2 slides of this just showing how many rewards we offer. I'll highlight a few of the really easy ones for a member to earn. That health risk screen, when we get a new member, we do a welcome call. We ask the members to do this short survey. They can also text the word survey and take it over the on their phone. but they get $50 for doing this. It takes about 10 minutes on average. So really quick, easy way to earn $50. A member getting a wellness appointment, just an annual visit, that's another $50. When I talk about our redetermination, members submitting paperwork to stay covered will get $40. And then we do a lot around just like other health related activities, vaccines, screenings, various things like that. You can go to the next slide, please. And then there's more of these. I'm going to get into a few of these more for the women and children because we have a very large program that we call Brighter Beginnings, where I'll cover some of these as well. But you can just see how we're targeting things that we know a member should do to stay healthy, and really we want to reward them for doing those things. Go to the next slide. So for dental and vision, County Care does offer, we've supplemented just the standard benefits that Medicaid plans offer. So our additional benefits that we offer is our members can get 2 cleanings per year, one every 6 months. We do root canals on all teeth and retreatment of root canals. And then we'll do an adjustment and removal of the braces if they were applied to the member under the age of 21 years. And we also offer partial dentures. And then for our children, we do offer a retreatment of root canals. And then our vision added benefit is any member that needs contacts or eyeglasses, they get $100. So they could get the standard frames that are covered, no money out of pocket. If they want to expand on that, there is a $100 credit they could use to be able to get a different type of glass frame. And then for our children, we do that every year rather than every 2 year. And then we also are the only plan to offer LASIK surgery. And this is for members between the age, we say 21 and to 45. I have seen it go up to 50. It just requires a doctor's sign off. And then there are some required activities. Members are usually pretty proactive with this. They get an eye exam with an in-network doctor who completes a form. And then once that evaluation, they're a good candidate, they will go through to be scheduled for that surgery. And then for our extra benefits, our Brighter Beginnings program, this is for our, we say families and children and pregnant women. But so any child in our home, 12 months or I'm sorry, 24 months or younger, up to date on vaccines, we mail out a diaper coupon every month. It's for a large size jumbo pack of diapers from Jewel Osco. So every month they can go get those for free. Members that are pregnant and have minimum of 4 prenatal visits are going to, they can call and request a sleep safe kit. And really the goal is this is so that the baby has a comfortable, safe place to sleep. So they'll get a pack and play that comes with that fitted sheet, a sleep sack for the baby to be in. There's a baby sleep board book and a pacifier. We also offer car seats. So for car seats, any member can call us and request one for if they have a child that's a member and they meet the age and height, weight restrictions, we will send them out a car seat. A pregnant mom could call us and we'll have that seat ready for her when she delivers. And as the baby grows, they can call and ask for a replacement seat and we will send that out to them. Another thing we have is a book club. So children 3 to 16 years old, the guardian can call us. We'll enroll them in a book club. It just takes one enrollment. And then each quarter, we mail them out an age-appropriate book. And if they're between the ages of 5 and 16, they will also get a $10 Target gift card each quarter. And then for our pregnant women, they can also get an automatic blood pressure monitor so they can check at home. And a double electric breast pump can be ordered each year. For those two, however, they're going to see their primary care provider and get the order, and then County Care will cover that. And then when I talk about easy ways for members to earn funds on their Visa Rewards card, as soon as a member knows that they're pregnant, we want to know about that. So we're asking them to notify us. We have this form on our website. All they need to do is fill it out. They're not attaching any medical. We're taking just them filling this out and telling us the information is true. And once they submit that, we process it and we do add $50 onto their rewards card. So I already touched on the LASIK surgery. The couple other items we do offer is our Weight Watchers. These are vouchers for members to go to the in-person meetings. They'll just call us, we'll send them out a month's worth and go to weekly meetings. And then if they want to keep going, they'll just call us again and we'll keep sending it to the members. And then we also offer home pregnancy tests. Again, they would call member services. We'll send them out a test per month. If they already have a Visa rewards card, we actually just put the funds on that card so that they can go purchase it themselves and not have to wait for it to arrive in the mail. And then another benefit we offer, we call it food care. This is through our partnership with a company called Food Smart. They provide our members with emergency meals. So if somebody has a food insecurity that they need meals, we will send them out 14 prepared meals delivered to members within 48 hours of their request. We have a general nutrition program. So our members can meet with a dietitian through a telehealth appointment. Their first visit, they're going to receive $50 in Instacart funds to purchase groceries to be delivered to their home. FoodSmart has an app that they would make the purchase through, but it links to area grocery stores. And then any subsequent visits with a dietitian, they will get $15 per week. And then we also have a medically tailored food program. So this would be members that maybe have a specific condition where they should be eating a certain way. We will, assess what that is and schedule appropriate meals to be delivered to their home. And then this is just like a member story from somebody who'd been working with Food Smart. So it was a single mom, and she'd been trying to get help from a dietitian for over 10 years, but was never able to connect. She joined Food Care in November to work on getting to a healthy weight and making better food choices for herself and her son. She lost over 40 pounds, started to realize how delicious fruits and vegetables are. It's also her son started eating better. And we continue to just get really good feedback. When I talk about our events, Food Smart actually comes out to basically all of our events, and they always bring 40 bags of fresh produce. And when they meet with a member and they talk to them about the benefit, they're able to sign them up with their first dietitian program or appointment. So it's been a really good partnership. And you can go to the next. So I wanted to do an overview of County Care and then let everyone know how they could select their health plan. So going back to when someone applies for Medicaid and they are approved, they're going to receive that information in the mail on how to pick a plan. They'll make that initial pick, and if they do not select a plan, the state will actually pick one for them. And they do look at past medical claims to try to make sure they're picking one that would be in network for that individual. So when somebody's in a plan, they are going to be locked into that plan, but they have an option to choose a plan every 12 months. So for County Care, we found that most of our members do have an open enrollment date between October and December with a January 1 start date. However, since the pandemic, we have seen kind of a shift in this. We had a surge in new members coming on in the summer months. So we actually have two surges, this one and one as well, July through October. But anyone can have an open enrollment period at any month. So the best way to find out when yours is to call Health Choice Illinois or to go online, and you can put in your information and it will tell you when you're able to make a choice. Go to the next slide, please. So this is for our members that are already enrolled in a Medicaid health plan. They will receive a packet in the mail about 60 days prior to their open enrollment date. If they receive this and they're happy with their plan and they do nothing, they're going to remain with that plan. They don't need to take any action. They will stay enrolled in that same plan. However, if they call and make a change and their start date is, we'll say, for example, October 1, they're going to be locked in on October 1 and unable to make a change for the next 12 months. So that's why it's really important if somebody does want to change plans, they really do their research and pick the plan that is best for them. And then just to give you an idea of how these mailings start, it's always 60 days in advance. So you can see we're about to hit October. So the packets will start going out to our members with that January 1 start date, and it will just keep going each month throughout the year. So when we have members or anyone enrolled in Medicaid, not only are they picking a plan, but they also need to keep showing the state that they're eligible to receive the benefits of being enrolled in Medicaid. This is called redetermination. And just to be clear, it's not always at the same time as open enrollment. So there's two things anyone enrolled in Medicaid needs to do at least every year. And it's important to know what months each occurs. Medicaid redetermination, I say it's annual, but if somebody also receives SNAP benefits, which is what we used to refer to as food stamps, that will happen every 6 months. So they will be doing this twice a year. And then if someone ignores the application they need to submit during this time, they will lose their coverage. So it's really important to spread the word on this. You can go to the next slide. So for the medical redetermination, the state will look at an individual's case or their family's case and determine if they can see using the systems that they have, if an individual or family still meets the criteria to be enrolled in Medicaid. And that's looking at household size, assets, income. If they can, they're going to call them this Form A. They don't need to send anything in. The state's going to mail them out a letter just stating we're renewing you for the additional 12 months. If anything changes in your household, it's your responsibility to let us know. However, the members that are found to be Form B, they are being mailed a short application to show that they still meet the requirements to remain enrolled in Medicaid. And if they do not submit this information, they will lose their coverage. And there's very strict due dates around this, which I will show you. And as I stated before, our county care members, we do offer a $40 reward for our Form B members that submit their information. We hope they do it on time. However, I'll talk about a reinstatement window. And so if our members are doing this, we're going to give them that reward once we're notified they completed this process. So just to show you the mailings, they actually come from the Department of Human Services, where that open enrollment packet is coming from Health Choice Illinois. So that's how to distinguish it. They're both going to have this outgoing envelope for the Form A and B. And then this is an example of the Form A. It's pretty clear. It just lists that they've approved the person, they put in bold that they'll keep getting benefits after whatever date that may be. And then next slide. The Form B is a packet. It's telling you you need to submit, answer the questions on the attached pages. It gives you options on how to submit these forms and the strict due date and the date that your coverage would continue if you do this. So this is just a chart to understand the mailings of the redeterminations. It's a short turnaround time. So right now, if we look at our members with an October redetermination date, they were mailed the forms on September 1st with an October 1 due date. We know living in Cook County, there are times your mail's not going to get to you very quickly. So by the time you get this, if it's a week or two in September, it's not a lot of time to review it, fill it out, and submit it by your due date. There's a built-in 15-day grace period that the state or the health plans, we don't really advertise that because we want members to submit by their due date. But understand if it's a few days late, they actually will still process that as if it were on time. But going back to the example of October due dates, if they're not submitting by October 15th, they will lose coverage on November 1st. Everyone that loses coverage due to redetermination, there is a 90-day period where they can choose to cooperate with redetermination. And if they do so and found to be eligible, that coverage will be reinstated and backdated to the date of cancellation. So for October members, they would have until the end of January to submit. But keep in mind, they would go without coverage up until the state looks at that and makes a decision to reinstate. So at County Care, we are doing a very broad campaign or strategy to make sure that we're sharing redetermination with every touch point, not only with our members, but our partners. So the Cook County Health Application Assistants, that call center I mentioned earlier, they are trained to be able to assist anyone, not only county care members that call them to do the redetermination. They can assist with doing that over the phone or answering any questions. County Care, we do a big campaign to text message and email our members so that they know when they are due, and we offer resources to help them to make sure they complete everything on time. We're at community events. We have a dedicated outbound call team that's calling our members constantly on the phone, offering assistance and making sure they know about their due dates. We can go to the next slide. So as a community partner, what we ask is that when you're speaking to anyone enrolled in Medicaid, that you do remind them that they need to know what month they are due. They need to make sure that their address for mail is kept up to date with not only their health plan, but actually the state. And then you can always share our calendar of events, which I will show you in the upcoming slide. And anyone with questions can call the Cook County Health Redetermination Hotline, which that number is pretty easy. It's 312-864-REDE. So if someone wants to verify that the state does have their correct address or they know that they need to change it, there's two easy ways to do this. If they call the HFS hotline, the number on the right here, that's going to get them to a live person who will take that information and enter it into the system, and it's done. And then that address will be carried over to the health plan so that we would receive it as well. They could also choose to complete it online. I will say doing it online is not quite as instant. It kind of tags it to a HFS worker to enter it at a later time. We don't always know the timeline, so it won't be as instant. You go to the next slide. And then we'd also like to ask that anyone working with a member would encourage them to complete their paperwork and locate their actual redetermination date. So not only to locate their date, but for help, all of these dots on this slide could help the person understand both. When submitting the redetermination, the preferred method is using the state's online system, the abe.illinois.gov. They will set up what's called a manage my case, and within that case will be their redetermination forms. They can answer the questions and submit it. That as soon as it's submitted, the state is aware that it's there. It'll keep them from being canceled if they're nearing the cancellation date. They could also choose to do this by the phone. So either with the first number here, which is a DHS call center that does redeterminations over the phone, or the Cook County Health REDE line. I will state both call centers do occasionally have pretty long wait times. So if someone's going to do it by phone, they may have to wait a bit to be prepared. Those forms that are mailed to the individuals, they can be returned by mail or by fax. I would always recommend faxing because we do know mail can get lost. And if they are faxing, to keep the confirmation. And then if somebody would like to return the forms in person to a Department of Human Services office, they can do so. They don't have to go to their local office. Again, though, I would suggest getting a stamped receipt from that office, just because paperwork can get lost on occasion. And then I will talk about our redetermination events that Marcelino touched on also. But County Care is out in the community basically every week, 5 days a week. And we target different areas to be, thank you, so that we know we're in spots that we know our members live, and we can really help them. But I'd also like to state, we don't restrict these to just our county care members. Anyone can come out. We're getting back to my slide, but at the events, we do offer for our county care members, we typically have a care coordinator. So if they're having any issues with making sure they're getting the benefits, scheduling medical appointments, or just any questions in general, a care coordinator will work with them. They'll also look to see if they've done that health risk screen in the last 12 months. If they have not, they will do it with them at the event so that we can give them that $50 reward. We do have individual from our member rewards that will sit with our members, show them what they have earned, make sure they have that Visa card. If they've lost it, we'll get them a replacement card mailed to them. And if they think maybe they're missing a reward, we can sit and research it. And if we find that they were missed a reward, we will pay it out to them on the spot. I mentioned Food Smart being there and giving their bags of fresh produce. And then we're there to help with redetermination, as well as anybody who needs to apply for Medicaid or SNAP, we can also help with that as well. If anybody is with an organization that would like to share our materials, we can send you each month this flyer. And then if you go to the next slide. This is our social media posts. If you have a social media outlet that you'd want to post our events, we can certainly share that. This just shows you what's coming up the week of the 19th. And we do these in multiple languages as well. And the flyer that actually lists each event too, we do mail those out to a lot of community partners so that they can have on hand and hand out as well. And I believe that's it. Thank you very much.
Thank you, Heather and Celino. That was a wealth of information. Thank you so much. And now it's time for Q&A. Q&A. And if you are on the call, please go ahead and put your questions in the chat. See someone with their hand raised. If you could please, if you have a question, just type that in the chat. I'm happy to get to it. So let's kick this off. Our first question we have is, do you make referrals for out-of-hospital birthing to PCC Birth Center?
So I think that's probably for county care, right?
Yes.
So our members would be able to choose. If they wanted to go there, that would be an option for them. It's the member's choice.
Gotcha. Thank you. Thank you. Hope that answers everyone who ever had that question there. And the next question is simply, how do I make an appointment?
An appointment?
Mm-hmm.
Marcelino?
Yes, so you can make an appointment at Cook County Health by calling 312-864-0200. That's our patient support center. So very simple, 312-864-0200. And a live professional will help you determine what your healthcare needs are and make an appointment for you at the closest facility where you live. Granted, if it's specialized care that you need, you may need to have a referral or see a primary care physician before you can go into specialty care.
Thank you. Next question. If I don't have a doctor, what should I do?
I'll answer it for county care. So when we receive a member in our plan, the state of Illinois sends us a file and they do list a primary care provider. If you don't know who yours is or you want to change it, you can call our member services, which that phone number is 312-864-8200. And then Marcelino.
And I think it's easy enough, right? Call 312-864-0200, talk to our patient support center, and they will help you find a physician, primary care physician close to where you live and make an appointment for you.
Great. Thank you for that. Next question. This is for Cook County Health. Does Cook County Health have any clinics in the Austin neighborhood?
Very, for sure. We have the clinic. We have the Austin Health Center located at the corner of Chicago Avenue and Cicero. So it's a multifaceted facility. In addition to the Austin Health Center in the heart of the Austin neighborhood, we have the Belmont Cragen Health Center on Fullerton, and we have the North Riverside Health Center in North Riverside, and those are also kind of close. But please see and go to the Austin Health Center at Chicago and Cicero.
Thank you. Thank you. So hear that, you guys? Chicago Avenue and Cicero. Uh, Next question is, how do I know if I qualify for health insurance?
There.
Um, so if somebody doesn't know what they qualify for, I would recommend calling our Cook County Health Application Assistance, which again, I'll repeat the number. It's 312-864-8200, option number 1. The staff there is able to screen the individual for Medicaid, or they could see if they qualify for any plans on healthcare.gov and the Cook County Health Care Link program, and then determine what would be best and assist with that application.
And once again, our CareLink program is the financial assistance program at Cook County Health, which if you don't qualify for anything, you please don't wait. Just make sure that you make a doctor's appointment. You will also be able to submit paperwork for CareLink, so you don't have to worry about paying bills. Your healthcare is more important. So we have the ability to ensure that there's assistance to cover expenses.
Great, great. Okay. Next questions. If I'm looking for coverage and a person that's not a U.S. citizen, what process should I take?
As recently mentioned, the CareLink program, which is part of Cook County Health, can help cover expenses, medical expenses, anywhere within the Cook County Health system. You can start the process by calling our financial assistance call center or application assistance center, 312-864-8200, option 1. They will at least provide you a list of things that you may need. You may have to meet with one of our financial counselors to submit the application itself. Once it's approved, you will have CareLink.
Great, great. This next question is kind of a two-part question. And it's, can I make appointments for my child? And do you all have any resources for families with children?
So I can answer it for county care. I'm not sure what that one is for, but yeah, so if any member, child or adult, anyone, if they're a county care member and they would like assistance with making appointments, they can call our member services. If they're looking for something that may require more assistance, every member within county care has access to a care coordinator. So if somebody maybe has a more extensive need where they want to set up a lot of different appointments or specialty or need referrals, anything like that, a care coordinator is a great resource where they can actually help schedule, make sure that everyone in the family is getting an appointment for what their need may be. And then for resources for families with children, again, we do offer our Brighter Beginnings program where there's the Sleep Safe Kit, car seats, diapers. One thing I will add that was not on that slide, we recently started mailing any member 12 or younger, a family that had a member 12 or younger, we sent them a coupon to use again at Jewel-Osco for a Brita water pitcher or that has the filter, because we're trying to make sure that children are drinking water without lead in it. So that is another resource we've been offering our families. Marcelino, do you want to respond for the health system?
Oh, no, definitely. I think you can call our patient support center and make an appointment for you and for your children, especially now that we're in back to school and children need to be vaccinated and have their health screenings. In addition to that, depending on the age of the child, we have different programs. If your child is a baby or up to the age 3, I think they may qualify for WIC. And then there's other programs that we have for children at different points in their life. But just call our patient support center and set up that appointment.
Great, great. And just to piggyback off that last question, how do I know if I have to renew my coverage?
Um, so anyone enrolled in Medicaid, they're going to have to do this at least once a year, possibly every 6 months. They could call, again, our Cook County Health Application Assistance or one of the state phone numbers, either the HFS or DHS hotlines could tell them. The other option is to log into their ABE, Manage My Case, and that way they'll set up their account. They can see their renewal dates. If they need to submit any information, it would be there at that time too.
Great, great. And how the next question is, how do I know when I can change or select my health plan?
So again, this will be different than the Medicaid renewal or redetermination. It's based on the month that they first joined the health plan. So it's 12 months later. If they're unsure of when that was, they could call the Health Choice Illinois and ask them what their date is. Again, in that AID Manage My Case, it'll also tell them the date they started with the health plan. And always make sure the address is up to date because the forms for the renewal, the redetermination, as well as the packet to select a health plan are going to be mailed to the mailing address that they provided the state of Illinois.
Great, great. And thank you, Heather, for that answer. Unfortunately, I believe that's all the questions that we have time for today. Uh, Please don't hesitate. If you do have any more questions or concerns, reach out to the hub. We'll be more than happy to answer those questions for you or connect you to Cook County Health and County Care. Uh, and to Heather and Marcelino, if it's like any last words you would like to leave the audience with, or any suggestions you would like, you're more than welcome to.
Um,
Go ahead, Heather.
No, I'll just say that again, if you're interested in sharing any of our materials, getting the word out on Medicaid redetermination and our events, please reach out to me and I will make sure you get everything each month. Thank you.
And from my end, I just want to say thank you to the ACT and the hub. But to anyone who's listening, it's like, don't wait. If you haven't seen a doctor in a long time, call us, set up that appointment. It's easier to deal with healthcare issues at the start rather than at the end. So there's resources available for you. Don't worry about, uh, you know, yeah, finances are important, but there's ways to ensure that you're able to get the care that you need. So call us, set up an appointment for you and your family.
Definitely. Thank you. I'm going to second what Marcelino said. Our health is extremely important, and let's start getting on top of it to prevent things and not be so reactionary when stuff isn't going so right. So I appreciate you guys for coming on today. If you requested services from the hub in your registration form, you'll be hearing from our team within the next week or so. We look forward to connecting with you all very soon. If you haven't done so already, you can go ahead and register for our next Hub 101 right now, which will be October 1st with Westside Health Authority, WHA, where we'll be discussing their employment program. Feel free to share the registration form with your Facebook friends, family, neighbors, or anyone who might think may be interested. Hope to see you soon. And again, thanks everyone for attending. Have a great day.
Great. Thank you.
Thank you.
We done?